for the clap. Okay, just letting some more people into the room. Everyone who's just joined us in the last couple of seconds, actually. My name's Mary. I'm the health educator at the Arthritis Movement. I've just switched the recording on for this session. I will kindly ask for you to switch your microphones to mute. There's going to be a lot of time at the end of this session for questions. If anything comes to mind throughout this presentation, feel free to use that chat box that you can see in the toolbar. It might be at the bottom of your screen or at the top of your screen. So feel free to pop any questions into that chat box and I'll revisit those at the end of the sessions when we have a Q&A session. Great to see so many of you here tonight. So we are talking about weight management for joint health. I will begin with an acknowledgement of country. We acknowledge the traditional custodians of the land on which we gather today. We pay our respects to their elders, past, present, and recognise our continuing connection to land, waters, and culture. I will begin this session with a real general disclaimer that we go through the effort to make sure all the information and advice we're giving you in these presentations are evidence-based. This isn't information to substitute any individual treatment advice. So if you do have questions that relate directly back to your individual treatment plans, I'll always advise you to go speak to your GP or your main healthcare provider. But I was saying just before, we will have a Q&A session at the end, and I'll do my best to help you out as much as I can. So today we are talking about weight management, and I want to start off with sharing the evidence base. I want to talk about why weight management is important in the context of ongoing arthritis management, whether it's OA or rheumatoid arthritis, or any of the inflammatory types of arthritis, and how weight loss can make a meaningful difference. I will spend more time towards the second half of this presentation talking about how we can actually achieve that. So we'll be sharing a lot of healthy weight management tips and tricks, and I'll link you into some really useful supports and services that are available to everyone, not just in New South Wales, but across the country. Letting some more people in. So, has anyone checked their BMI? I'm just going to switch everyone to mute. If you want to talk about BMI, I'll encourage you to share your experience in the chat box if you want to. But BMI, for context, is a really helpful starting point to understand your weight in relation to height. But I will say that it's just one very small piece of the health puzzle. And I'm going to say that BMI is actually not always the best measure to reflect health, especially if you're an athlete, you carry a lot of muscle, or even if you have a medical condition, arthritis as such, or any of the other comorbidities. There's a lot more that comes into play when we're talking about general health screening. But I do want to say and preface this presentation, we do refer a lot to BMI if I'm talking about the evidence base or I'm referring to research, and it's only because it's the most relevant metric across medical and research communities. So it allows for that, consistency and comparability between studies, and you can always check where your BMI is at through the link I'm going to share with you in the chat box. Out of interest, you can click in the link. It's through the Heart Foundation. I'm just going to see. I might share that at the end since it's not copying. But you can see where you measure against, the categories. If you are concerned about your BMI, your body mass index, it's always a good idea to talk to a health professional, whether it's a dietitian or a general practitioner, because they're the best people to recommend personalized strategies based on your specific health needs. So there is really good evidence that weight loss has a meaningful effect, particularly in osteoarthritis, and it's considered one of the cornerstones of treatment for not only managing osteoarthritis, but improving function, improving pain symptoms, even preventing the worsening of osteoarthritis. So what we know from the research is that being over your healthy weight range not only puts you at a higher risk of developing osteoarthritis or worsening pain symptoms, it could sustain the pain symptoms. It can influence the progression of disease. In terms of rheumatoid arthritis, we know that it could, one, potentially act as a trigger for some people, but it can also certainly increase the severity of disease. Now, I'm going to talk about the complexities of weight loss when it comes to rheumatoid arthritis shortly, because weight loss is one of those things that doesn't always want to be achieved for all people with that condition. But we're going to be talking about it in the context of where healthy weight management can play a role. And so obesity has been identified as a factor that can decrease the odds of achieving remission in rheumatoid arthritis, but negatively impacts disease activity. And we know this from some studies that have followed patient-reported outcomes during therapy. In terms of how it influences risk, what we know is that overweight women who surpass a body mass index of 25 kilos to meters squared have nearly 4 times the risk of knee osteoarthritis, and overweight men who surpass a BMI of 25 kilograms meters squared have nearly 5 times the risk of knee osteoarthritis. So what that's telling us, if you're dipping into the overweight, obese categories on BMI, there is a correlation with the risk of osteoarthritis. In terms of rheumatoid arthritis, one study has found that obese women are more likely to develop rheumatoid arthritis compared to women with a normal weight. So it can even be as high as 2 to 3 times higher. And this is because there's 2 major pathways involved. One is the load, another is the inflammatory pattern. And so obesity impacts both of these things. You can almost call it like a double whammy. And that's what I want to explore with you. So in those who have osteoarthritis, particularly in those load-bearing joints like the knees, the hips, the ankles, the feet, and they're also overweight or obese, weight has a really big influence on that joint load. So every time you're taking a step, it's almost 4 to 5 times higher in joint load than what it would be if you were in that normal healthy weight range. So as weight increases, we know the load on these joints also increase exponentially. And so when your joints are having to deal with those excessive compressive forces over really long periods of time, eventually that's going to affect things like the biomechanics of the joints, which can cause things like malalignment of the joints, gait abnormalities. And then if this is paired with relatively low skeletal mass, this can lead to further degeneration in some of those structures of the joint. So not just cartilage, but it can affect the bone. It can result in a loss of stability and support, making someone a bit more prone to falls and fractures and injury. And so that's pretty much what's happening from a load perspective. But then on the other hand, what we're starting to learn more about is how excess weight can also influence that inflammatory pattern in the body. And this is because a few things. We know that excess weight or excess fat tissue produces things like inflammatory molecules, so things like cytokines, which have been attributed to the breakdown of a number of tissues and structures in the joint, particularly cartilage, bone, tendons, can influence muscle mass, but it can also increase something called hyperalgesia. So when I'm saying hyperalgesia, it's basically a pain sensitivity. It's making people more sensitive to pain signals. So this is why weight loss can have a meaningful effect, and we're going to talk more about that shortly. So there's a lot of studies that show just as little as 5% weight loss can reduce pain by up to 30%. For some, it can be even more. And this is actually the same as half the people who take anti-inflammatory medications and report achieving a reduction in pain of about 30%. Some people, they can achieve a pain reduction by up to 50%. So if your healthy weight target is around 70 kilos and you weigh 80 kilos, that's a meaningful difference in pain relief you could achieve. And whilst it's not a huge amount of weight loss that needs to be achieved, but just a small amount can have very positive outcomes. There's a lot of benefits to weight loss. Not only can it help with improving pain, but there's good evidence that it can improve function. It could potentially reduce the likelihood of a joint replacement surgery down the track. For those who are already on that waiting list and ready to undergo surgery, weight loss can also offer significant benefits to the recovery and rehabilitation process following that surgery. So that's why sometimes doctors will actually encourage you to lose a little bit of weight before going for the surgery, because not only can it help with lowering the risk of complications like infections and blood clots, maybe delayed wound healing, but it might reduce the likelihood of needing that longer hospital stay, and that can make the biggest difference to someone's experience in hospital. It can also make post-surgery rehabilitation easier. It can extend the lifespan of a joint replacement, delaying or preventing the need altogether for revision surgery. And so I could probably go on there, but if we look at the data, it suggests that weight loss can pretty much give you a lot of bang for your buck if you're in that situation. In the context of rheumatoid arthritis, losing as little as 5% of body weight can not only help with overall systemic inflammation in the body and those symptoms that correlate with that, but it can also help with the body's response to treatment. It can lead to better symptom control, making remission more achievable. So there was a study that was done in a group of patients who were obese and living with rheumatoid arthritis. Those who achieved greater than 10% weight reduction actually achieved a remission rate of 55.6% at 6 months. So that was made a meaningful difference to some people who were living, in excruciating pain. But there is this perception. So the more weight loss that is produced, the better it is for our disease management. So going back to the studies, a study found that if you are overweight or obese, losing just 10% of total body weight can cut arthritis pain in half. Losing 20% can cut arthritis pain by another 25% or even more. So the more weight loss that is produced, of course, the more that force is going to be reduced and thereby create less stress and force placed on the joint, thereby helping with that pain. If your BMI is above 30 kilograms meters square, so it's dipping into that obese category, 10% of weight loss is actually not a lot, but it's proven to be very good for reducing osteoarthritis symptoms significantly, whether exercise is included or not. So for people with inflammatory rheumatic diseases, weight loss can serve as a very effective non-pharmacological treatment option for both disease activity and cardiovascular risk profile. Whether this is the better outcome is actually debatable, given the evidence suggests that any amount of weight loss, whether it's actually 5%, 6%, say it's not even the full 10%, any amount is suggestably good. And the best weight loss is weight loss that is sustainable and is incremental. So there's been several studies that have investigated the association between high body mass index and risk of OA. But this study in particular was interesting because it investigated the relationship between high BMI and one, the occurrence of structural defects in the knee with osteoarthritis, and two, the progression of osteoarthritis using radiography. So what the researchers did, they studied the X-ray data from 3 different groups of people over a 4 to 5 year period of time. They found key benefits linked to even just the smallest reductions in body weight. They discovered that for every 1 unit decrease in body mass index, there was a 5% lower risk of developing osteoarthritis in those without it. There was also a 5% lower chance of existing osteoarthritis worsening. They also found less joint space narrowing, which is often a sign of cartilage breakdown, and then fewer bony growth. So if anyone's heard of those bone spurs or osteophytes, they did notice fewer bony growths developing in the knee. So they found that weight loss had the most protective effects on 3 things. It was the inner medial knee joint, which is the part that actually bears the most of our weight, cartilage thickness, and bone changes. So while some studies suggest that body weight alone doesn't predict osteoarthritis progression, and that's because if we think about osteoarthritis, it is a disease of the whole knee joint. There's a lot more to the disease than just the structural changes, but they did highlight that factors like knee alignment and movement patterns also play a role, meaning that a tailored approach to weight management is actually proving to be the best way to protect knee health and overall long-term joint health. Some more people in. So we've covered a few benefits behind losing weight in the context of osteoarthritis, and touched on the context of rheumatoid arthritis. So even just a small amount, and when we talk about a tailored approach to weight management, we should be thinking about exercise, diet, and joint-friendly movements. Whether it's diet, exercise, or both, or individually, there was a study that looked at which method is favorable here. So in a recent 18-month randomized controlled trial, researchers, they aimed to investigate which method for inducing weight loss was going to be the most effective for overweight or obese adults with knee osteoarthritis. So they looked at its impacts on knee joint loads, inflammation, and clinical outcomes. One group was prescribed diet, one group was prescribed the exercise. There was another group that combined both methods. I'm going to let you have a guess which intervention was the best for improving knee pain, function, mobility, and just overall quality of life. If you can type your guess into the chat box, I'll reveal all in just a second. So all 3 groups did really well, but the winner was diet and exercise combined. The results actually found that the intervention led to reduced knee joint loads, reduced inflammation, and improved clinical outcomes. So this study was really promising with the overall benefits that came from implementing an intensive diet and exercise regime for the purpose of managing knee osteoarthritis. What's important to note here, though, is that diet and exercise is really good for arthritis. We can say that with certainty, but it's a weight loss outcome that really produces those meaningful benefits when it comes to pain symptoms. So for some people, you can be doing all the exercise, following a very healthy diet. If there are medical reasons as to why you can't achieve the weight loss necessary to manage your health condition, that's when it might be advisable to go speak to your general practitioner, your primary healthcare doctor, to see what else is going on and what other treatments could be available to support the weight loss journey. So this leads me into answering the next question that we get all the time. What is the best diet for weight loss? So we will have more of a dietary focus here. Because when it comes to dieting for weight loss, there are many different iterations of what a good diet for weight loss looks like. So some people swear by keto, others advocate for low carb, low fat, maybe it's intermittent fasting. I'm sure if everyone jumps on social media, you'll see some new diet pop up in your Facebook feeds or on Google News. But, there's a lot of different diets out there that exist. And while we have good data that shows that almost all of these diets can certainly work for weight loss in some way, we don't really have good data to show us how people can maintain that weight loss through those methods. So of course we see short-term success for many of these approaches, including those low-carb diets. All of the popular dieting approaches fare poorly in terms of weight loss, weight maintenance, and adherence, especially once that 6-month milestone is passed. None of the popular approaches are really deserving of the title Best Diet for Weight Loss. And this is because there's a lot more that's required for sustainable weight loss. So there was a large randomized controlled trial that followed over 800 overweight adults to assess how variations in fat, protein, and carbohydrate intake could impact weight loss. Participants were assigned to different diets. The carbohydrate intake ranged anywhere from 35 to 65% of total of the distribution, with total energy and protein making up the remainder. So over the 2-year study, participants received both group and individual support sessions. After 6 months, all the diets that were trialed led to an average weight loss of about 7% of initial body weight. So that was ideal, that was good to notice, but much of this weight was actually regained over the following 2 years. So these findings very much align with what other studies have looked at, reinforcing the real challenge is not losing the weight itself, and it's not the method itself, but it's about maintaining it. So that's where the real challenge lies. There's been a lot of high quality clinical trials that consistently show that the specific macronutrient composition of a diet matters less than the long-term adherence to a very balanced and sustainable eating plan. So what does make up a successful weight loss approach? And it's a combination of strategies, and it's not really a one size fits all. Diets should be best tailored to you. It should follow what we call a person-centered approach and suit your needs. But there are a few pillars to what makes up a successful weight loss approach, and you can see them all indicated here. Starting with the calorie deficit. So losing weight, it is all about balance in the most oversimplified way I can describe it. Your body needs to burn more calories than it takes in. So of course, that's always going to be best guided by a professional like a dietitian or a nutritionist. And this is often achieved by eating smaller portions, choosing healthier, low-calorie foods, more nutrient-dense foods, and staying active. So when we talk about simple changes like swapping sugary drinks for water or adding more veggies to your meals, even just including that small walk each day, these are the things that help with achieving that balance and can make a meaningful difference over a period of time. Secondly, focusing on nutrient-dense foods. So focusing on eating those fresh, natural whole foods like fruits, vegetables, lean meats, nuts, whole grains. These are the foods that give your body the nutrients it needs to stay healthy, nourished, and energized. So trying to limit those sugary snacks, limiting that fast food and ultra-processed food. These foods contain a lot of unhealthy fats and extra calories that aren't very conducive with healthy weight management. So these are often foods that can very much hinder the process. By prioritizing those nutrient-dense foods, you can make a huge difference to the outcomes you see. Sustainable eating habits. So instead of trying extreme diets that are hard to keep up with, aiming for an approach that you can maintain over the long term is really important. It's about finding balance in not just your eating habits, but your relationship with food, rather than adhering to really strict rules and going for an all or nothing approach, which I'll elaborate on shortly. So all of the nutrients are important in diet, but particularly protein. So you might hear of people talking about a protein-rich diet and why they can help with weight loss. I want to speak about it from an aging perspective. And I guess after the age of 30, we all naturally lose muscle. These things over time can worsen joint pain. It can worsen mobility issues. Protein has an incredibly important role for not just preserving lean muscle mass, but supporting metabolism, and it can help with feeling fuller for longer. So a protein-rich diet is very effective for stabilizing blood sugar levels, which not only helps with managing comorbidities, particularly if you're at a high risk of type 2 diabetes, maybe you've been screened by the doctor, but stabilizing the blood sugar levels can actually help with reducing those cravings. If you're someone who gets those really sweet, intense, sugary cravings, particularly towards the end of the night, or 3 p.m. in the afternoon is what we seem to hear about from an office worker's perspective. Just increasing that protein in the diet can help with sustained energy levels. And so when we're talking about good sources of protein, we are talking about those lean meats, those fish, eggs, legumes. Maybe it's dairy for some who can tolerate it, or tofu. And there's a lot of, protein alternatives if you are vegan or vegetarian. Exercise and movement. So strength and training helps you keep the muscle whilst losing fat. So exercises like walking, cycling, swimming, these are all great for burning that energy we're consuming, but there are a number of other benefits that come with it. So improving heart health, helping with those sugar levels, even just small daily activities like walking or taking the stairs, these can make a big difference. And then if we think about sleep and stress management, lack of sleep and high stress not only interferes with hormones, particularly your appetite and stress hormones, but it can lead to certain behaviors that can very much hinder effective weight loss. So if you're a sucker for watching Married at First Sight at nighttime, and you're someone to go for the sweet treats while you're watching that, indulging in those high sugar, high fat cravings is definitely something that can naturally occur the later we stay up at night. So trying to get that 7 to 9 hours of quality sleep each night not only helps from the hormonal side of things, but it can help with controlling those behaviors that can prevent you from achieving your goals. Even including those stress-reducing activities like meditation or deep breathing can really help with establishing a routine that's going to be conducive with your goals. Hydration, so drinking enough water is known to boost metabolism, help control appetite. Very often, thirst can be mistaken for hunger, so staying hydrated can actually also help with that unnecessary snacking that we eventually indulge into. And consistency over perfection. So I will speak to that very shortly. Who's ever attempted to achieve a weight loss but has found it incredibly hard? Interesting to hear if you found it hard or you found it easy, or where the sticking points were, and if that's in maintaining the weight loss you've achieved. Many of us who have attempted to achieve weight loss before, I'm guilty of it, probably have acknowledged that it requires a lot of patience, motivation, perseverance, and discipline. So for some people, if anything, most people, it can actually be quite hard. But unpacking why it's hard can be really important in the context of understanding and overcoming your barriers. Um, Everyone experiences is different. Everyone has individual barriers, and it's important to understand what they are if you're going to look at solutions to overcome them. In the past, if you have found it difficult to stick to a weight loss program, was the diet and lifestyle too rigid? Did you lack support? Were unrealistic goals set? Were you just time poor? Do you have family to care for, and so your needs come below theirs? Did you have financial constraints? We know at the moment with the cost of living, healthy foods aren't the most affordable foods for all. These are all very common barriers that can actually prevent us from eating a little bit healthier and moving a little bit more. And so there's so many reasons why weight loss attempts can fail that go well beyond motivation and willpower. Why diets fail is either because the diet is too restrictive, maybe it's going back to the mindset, and maybe it's looking at the motivation to get immediate results coupled with an all or nothing mindset. If you're not focusing on lifestyle changes and you don't have a plan, this can make it harder to achieve or maintain the weight loss. Sometimes there are solely biological factors at play. So there are hormones. Sometimes medications can cause you weight gain. Maybe weight loss isn't the goal. The weight loss plan, it might not be suited to your individual medical or your physical limitations. Then there's also a psychological component as well. But focusing solely on short-term goals without incorporating any long-lasting lifestyle changes, paired with not having a well-defined plan, these can all contribute and play into the challenges of not achieving and maintaining that weight loss success, which is why sometimes it's really important to have a health professional who is receptive and supportive of you, and being open and transparent throughout the entire journey to assist your level and readiness to change your lifestyle and the behaviors that are setting you back. So this is why it's really important that you do know your barriers. So often when we do set goals, it's really important to make sure that they are set with intent. When goals aren't meaningful or achievable, nor are they aligned with your values, the chances of succeeding are very small. So while it's good to have big long-term goals, it's just as important to focus on those small practical goals by way of maintaining that food freedom and keeping a healthy mindset when it comes to the challenge. So for example, by focusing on what to include, not exclude, like focusing on increasing intake of fruits and vegetables and whole grains and those lean proteins and healthy fats, that's a good starting point. So if you were to look at the guidelines, the Australian Dietary Guidelines, they recommend 2 pieces of fruit per day and 5 vegetables per day. And these are great targets. They're very achievable. You could do this by adding an extra piece of fruit into your breakfast or making sure you're having at least 1 snack paired with fruit. As for dinner, throwing in an extra vegetable or 2 to your pasta, your salad, whatever your favorite foods are, can make a big difference. By following this plate model here, you can ensure that your meals are balanced. They're filled with nutrients that your body and your joints need to stay healthy. And it makes it easier to eat in a healthy way. And I'll show you how this model works very shortly. Another tip is that you don't need to completely, I'll just make sure everyone's on mute. Another tip is that you don't really need to cut out bad foods or adopt that black or white approach to foods. Instead, just focusing on small things like adjusting portion sizes, to make those indulgences a little bit more manageable. And so a really good example of doing this is by using just smaller plates for dinner. This can naturally encourage smaller portions, helping you achieve that balance. If you're someone who actually enjoys snacking, just pre-portioning those snacks into those smaller containers or Ziploc bags, this can be especially helpful if you're the snacker I was talking about who likes those chips while we were watching Married at First Sight or The Bachelor at nighttime. By doing this, you can prevent mindless snacking, keep better track of how much you're eating, and helping you stay within your calorie goals without feeling deprived. Sometimes it's just about shifting away from the black and white mindset when it comes to food. You can also keep your favorite treats into your dinner, your diet mindfully by learning about those recommended serving sizes. And I don't know how many of us actually pay attention to the label on foods or the serving size portions, but this is a really helpful tool for avoiding unintentional overeating or swapping high calorie foods for lower calorie alternatives. The most important thing is to really enjoy those treats, but without the guilt. Having one of those treats during the day or at nighttime is not going to derail your progress in any kind of way. Weight gain is a result of the cumulative effects of a diet. So what truly matters is really how you approach your food choices throughout the whole day and the week. So the healthy plate model you saw on the previous slide is a real simple visual guide to help you create balanced meals. It focuses on portioning your plate to include a wide variety of nutrients. And so how it works is that you can see it's divided into 3 sections. You can see on the right, half the plate is made up of vegetables and fruits. So the recommendation here is to fill half your plate with non-starchy vegetables like your leafy greens, your carrots, your broccolis, peppers, or fruits. But the idea is that you're getting fresh whole foods in this section of the plate that's packed with the vitamins, minerals, and fiber to help keep you full without adding many calories. Someone is drawing on the screen for some reason. 1/4 of the plate is made up of the lean protein sources I was mentioning a little bit before. This can include those lean meats like chicken, turkey, or fish, but also those plant-based proteins such as tofu, legumes, or beans. Protein, again, is such an essential nutrient to actually maintaining that muscle mass, supporting our metabolism. But if we think about our joints and the support we want to give them by focusing on strengthening the muscle above and below the knee, that can help with, osteoarthritis, particularly if you're finding you are experiencing reduced support and stability. So the remaining 1/4 of your plate is suggested that it should be whole grains or starchy foods like brown rice or quinoa, sweet potatoes, maybe whole wheat pasta. These whole grains or starches are important because they do provide you with that long-lasting energy. If you've ever followed a very low carbohydrate diet before, you might remember how short-lived that restriction lasted for and how long it was before you were indulging in those carb-rich foods. But by prioritizing the fiber, will give you a better handle over those cravings and help stabilize them a little bit more. Healthy fats. You can absolutely add small amounts of healthy fats to your meals. Olive oil, avocado, nuts. These are actually very important for helping with nutrient absorption. So if we think about our joint structures, they're all made from different dietary factors. We know bone is made from calcium. It requires vitamin D, vitamin K. These are all dietary factors. And so having the olive oil can help with supporting the absorption of those. Not only that, they can help with promoting heart health and reducing risk of any dietary related diseases. So while you can imagine your plate to look like this model on the right here, it's these pictures on the left that you can see how it translates to meals that can easily be made in that house. You have teriyaki chicken, veg, stir fry, quinoa salad. You can have yogurts and fruit bowls, sandwiches, whatever your favorite foods are. There are ways to adopt a healthier approach to them. So overall, the key to long-term success lies in some of the common themes and strategies that predict healthy weight maintenance. So becoming and staying more active alongside a moderately energy-reduced diet, prioritizing that good quality protein in every meal as well as healthy carbs and fats can help with regulating that appetite. Try to eat at home a little bit more often. You'll be surprised at how much energy you can save yourself from consuming. And it does make a big difference in the long term if you are trying to achieve sustainable weight loss. Aiming for that 2 to 3 serves of fruit daily, at least 5 different vegetables. Focusing on those whole foods makes it so much easier to hit all your nutrient goals. If you've ever do hunger check-ins or you've never done it before, I would encourage you to adopt that approach just before lunchtime or dinner, and make sure or particularly snacking, make sure you're hungry before you're eating. Sometimes that hunger can be mistaken for thirst, so keeping that water up is important, staying hydrated. And being physically active every day, again, is such an important component of healthy weight management. But if you do struggle with emotional eating, you do struggle with cravings and can't seem to get on top of that hunger, if you're eating healthy but not seeing any changes in your weight, if you have an all or nothing mindset, if you're often succumbing to new diets or food trends, if you're feeling overwhelmed around food, you want to lose weight but not sure where to begin, need help just setting goals and staying accountable, these are all the signs you could really benefit from working with a health professional, particularly a dietitian. Again, if you do struggle with weight loss despite all the attempts, it is a challenge for you. There are doctors who do specialize in obesity medicine, and they're equipped with the knowledge and skills and able to treat you appropriately to help you overcome these struggles, which is important if it's going to be part of your ongoing arthritis management. So we have enough research that tells us you can achieve a healthy weight and get healthy without the restrictions. But goal setting is really important here. And I do want to reiterate that the goals do not have to be huge. So we don't have to aim for 30 or 40 kilos weight loss before a big event coming up. Aiming to lose just a small 5 to 10 kilos would be realistic. It's not easy, but it's certainly going to sound more doable than 30 kilos. It's about making those goals smaller, setting them to give you the clarity on what you want to achieve. It really helps with focusing your time, your energy, and resources on specific objectives, reducing the likelihood of feeling overwhelmed or directionless. They're also a good way to actually measure your progress. And I do want to say that whilst achieving a certain weight can be great and aiming for a number could be great, but also looking at things like your energy levels, your function, your symptoms, your pain. These are things that are important to measure as well. So these goals are important. You'll find a big difference in your mindset, your motivation, even the outcomes if you are to focus on those small goals and even what you can control as opposed to what you want to achieve. So this doesn't happen overnight. It's not easy by any way, but there are a lot of people there to support you. You have a whole health team there that can assist you with setting the goals and keeping you accountable. It's also being realistic. Be prepared for it to take time depending on where you're at. Like I said, it's not a one-size-fits-all approach, but you can absolutely get to where you need to be, but make sure you are reaching out to your health team that are there to support you. So these are additional resources and services you can access. Nutrition Australia are a non-profit organisation. They have a lot of fantastic recipes and healthy weight management tips and resources that you can access and download for free. They have a whole bunch of dietary guidelines that are easy to follow. The Get Healthy service is a government-funded free phone coaching service, and you are connected with qualified health coaches and dietitians to actually help set nutritional goals and improve those nutrition habits to help achieve the weight loss you want to achieve. You can also find a local dietitian and you can ask your GP to connect you. So under the Medicare scheme, you can access funded sessions and you'll be connected with a dietitian who can support you. And sometimes that's where you need to go in terms of achieving the weight loss, especially if you have struggled in the past before. We do provide webinars and we have some more coming up in the nutrition space and also the exercise space, where we give you the information to help support your goals. So that brings us to the end of the presentation. I can see the chat box is absolutely going off at the moment, but I want to open the floor to some questions. So what I'm going to do is I'm just going to pause the recording here and don't want to create breakout rooms.